Hello everybody. Today we are here to discuss on the posterior urethral valve, which is the leading cause of pediatric renal failure and renal transplantation. It most commonly occurs in the males with an incidence of 1 in 8,000 to 25,000 of the male live births. And type 1 of the PUV is the most common and accounts to 95% of the cases. It can be diagnosed antenatally at an early age of 12 weeks and has a classic keyhole sign. The investigation of choice is the micturating cystourethrogram, in which the bladder obstruction and damage can be noted. The treatment is endoscopic valve ablation, which can be performed in a neonate of even less than 2 kg weight. Post operatively, it has a complication of the wall bladder syndrome, in which the patient suffers lifelong urinary incontinence and progressive renal failure. The other most important consequence is the Potter sequence cascade, in which the urine obstruction leads to oligohydramnios, causing secondarily pulmonary hypoplasia and facial deformities. The bladder tries to release off the pressure by 4 pop-off mechanisms. The first one is the vesicoureteric renal dysplasia, in which the unilateral vesicoreflex acts in 30 to 5% of the cases, causing ipsilateral renal dysplasia. And the second is the urinary ascites, in which one of the renal system structure damages, breaks to leak the urine into the abdominal cavity. And third is the bladder diverticula, in which the wall absorbs the fluid and herniates. In fourth, the urachus becomes patent and the communication between the umbilicus and bladder is re-established. Thank you. Bye-bye.